The El Cajon Police Department is defending a change to the way it responds to a mental health crisis. The department made the decision back in May and presented a report to the City Council about the new policy tonight.
They no longer automatically send a police officer to every mental health crisis call and instead send mental health teams contracted by the city. CBS 8's Alex Cheney was there and brings us more. Alex?
Yeah, that's right. The El Cajon Police Department told the City Council tonight that they haven't changed their policy. They've just added an additional step to make sure that police intervention is necessary during mental health calls that involve either crime or danger. Keith MacArthur from the El Cajon Police Department says officers are not mental health specialists and just being on scene can make things worse.
Our mere presence could escalate a situation, forcing us to use force when, if we didn't show up, maybe that episode passed.
The new approach follows a federal appeals court ruling that 2 Las Vegas officers forfeited their qualified immunity when their use of force led to the death of an unarmed man with schizophrenia. El Cajon police say they will show up to mental health issues, but only if they meet certain criteria.
And we'll respond anytime that there's been a crime committed, that crime is currently being committed, or that there's any other threat to public safety.
During the council meeting, police showed the number of calls they've received for welfare checks, involuntary psychiatric holds known as 5150s, and others, saying medical professional teams contracted by the city to deal with these calls put less of a burden on officers.
We haven't changed our policy. We've just added a step to ensure that our officers have a legal reason to go to these mental health calls.
In opposition to El Cajon Police, District 2 Supervisor Joel Anderson said in a July letter to the City Council, quote, "This change leaves a critical gap in response and effectively prevents the county's PERT clinicians from intervening, as they must have El Cajon City law enforcement personnel paired with them in order to respond." MacArthur says the medical crisis response teams and psychiatric emergency response teams operate without an officer.
Program managers, clinicians, and peer support, and they don't use an officer, and they go out and they try to intervene when somebody's in a mental crisis without using law enforcement.
The El Cajon Police Department wants to make sure that it's making the most efficient use of its officers, while opponents say it's leaving gaps in coverage. Reporting live, I'm Alex Cheney, CBS 8.